to you at Verizon and talk about a specific program that you'd like to highlight where you're unlocking some of this capability with the technology that you all provide.
Yeah. One of the areas that I get really excited about in pretty much every conversation I have with anyone with a major health system, we talk a lot about health equity and digital inclusion. And certainly Verizon, we've done a lot around digital inclusion, initially starting out in the education area, and then we've kind of moved that into the healthcare space. So, when you think about folks who are making under, $30,000 a year, 42% don't have broadband coverage. 25% of those don't have a cell phone, right? And so those individuals were certainly highlighted during COVID. And so we're really focused around improving access, putting, and I think about, the VA, and I grew up, in naval hospitals, right? Both my parents, they ended their lives in VA hospitals, so spent a lot of time within the system. And I think a lot about, health equity and if you're familiar with the Affordable Connectivity Program, we have a program around health equity that kind of sits on top of that. So with the government that's offering assistance around broadband coverage, we can actually get those individuals' devices in their hands to help manage their health care. So really what we're doing is we're focused on just providing more in-home services, right, through our mobility and our mobile solutions. And I always say, I want to make healthcare proactive. And what we're doing with devices, purpose-built devices, we can load chatbots on those to interact with patients. Hey, how you feeling today? Did you take your medicine this morning? You have a doctor's appointment at 4 o'clock. Can I call you an Uber? And then imagine that patient taking that purpose-built device with them to the hospital. There's geofencing from the medical center that recognizes the patient, welcomes them, tells them where to park or where to get dropped off, wayfinds them to their appointment. Infotainment should the physician be late or whatever, start interacting, filling out forms. So to make healthcare more proactive, those are some of the projects I get really excited about around health equity and digital inclusion.